I will just talk a little bit and then, yeah. So, in the eyes of Westerners, especially for doctors, traditional Chinese medicine might be mysterious or outdated or idealistic. But no matter how different our philosophy, no matter how different our methodology are, we are observing one thing, life. We are observing the same thing, life. So in some dimension, we should be able to understand each other and we should be able to conclude same thing, right? So today, I'm not going to talk about meridians, yin and yangs, 5 elements. I'm not going to talk about that. I'm going to talk about life in common cognition. Okay? So, Chinese medicine always explain Jing, Qi, Shen. Have you ever heard about it? Jing, literally translate. Jing is essence. Qi is energy. Shen is spirit. I see some people say, uh-oh, I cannot follow that. But if I say this is exactly what quantum physics talking about. Jing, essence, is our structure body, is particle. Qi, energy, is our functional body, is wave. Spirit is how our doctors, treatment therapists be in the process of healing and influence the result. And that's we called particle-wave duality, right? Okay, so today we are going to more focus on the first part, the structure body, the fascia part, that everybody could see, everybody could observe, everybody could feel. Okay? And if we have time, we could also demonstrate the Qi part or the spirit part. Okay? So, we are talking about pain. So what is the mechanism of pain? What causes pain? People will say, come from inflammation, like plantar fasciitis, like tennis elbow. But if I say, I can remove the pain in one session, but inflammation is still there, are you still believe the pain coming from the inflammation? Or people say, might be coming from tissue proliferation, like a hernia or like a spur. It's there. But if I say I can take out of the pain, but spur is still there, the hernia is still there, will you start to rethinking about that? So we know pain receptor are tension receptor. That means if the tension in the intertissues are increasing and exceed the limit, these receptors will active and our brain will receive a signal. They will produce a nerve impulse to our brain. And when we brain receive this signal, it's pain. That's how we get pain. That's all about tension in our body. Just imagine our body like one piece of wetsuit dropping in our skeletal system. Every twist, it can be a tailor's twisting in your ankle, it can be an injured tailbone, it can be a scar tissue, or it can be an inhibited nerve system. And anything would cause a twist, will cause a pull, right? And when this happens, it's like nails in our body, and our body can no more compensate. So normally I can move like that with my clothes. And when there is something like a scar tissue or injured tailbone, it's like a nails. It's no more possible to do this. And then the receptor will active, and then we have pain. And I can demonstrate and prove that to everyone. So if we understand why we have pain, so the solution is there. We trace, we feel the body, we trace where the tension comes from, and we solve it. We put back home. And that's how we treat pain. Are you ready for the volunteer to see how it works?
Yeah.
Okay, who will be the first?